It is a stunning revelation for parents and children around the world. According to an investigative report out of London, the doctor who first linked autism to childhood vaccines deliberately falsified his study. The investigation, published by the British medical journal BMJ, found Dr. Andrew Wakefield falsified the findings for financial gain. According to the report, Wakefield and his colleagues altered the facts surrounding the 12 children who were studied. The 1998 research spawned alarm among parents already leery of over-vaccinating their children. So the question, of course, becomes, what should parents do on the heels of this new report?
We have another
have
doctor.
to help me with this name.
Sonu Ahluwalia.
That's right, she says it.
Sonu Ahluwalia. He's been here before many times, but just not with you.
Yeah, not with me.
So, doctor, we talked about the fact that,
Yes.
the doctor that was on our show last night said, talk to your doctor, blah, blah, blah. When I first had a baby, they wanted to stick a needle in her foot right away. My husband questioned it. He said, what's this for? They said, well, it's for, when she becomes sexually active. He's like, she's a day old. So you can ask your doctor, but until you, sometimes the doctors that work at medical facilities are also, funded by pharmaceuticals and things like this, so they could be pushing things that, how do you trust people?
Well, this research is from 1998. That was a long time ago. And we didn't have rules and regulations as strict as they are today.
Okay.
So we've really cracked down on any kind of drug-related or manufacturer-related sponsorship of things.
Okay, that's good.
So now when studies are published, we have to declare who we're getting money from, for what reason.
Okay.
Yes, before the studies are published, we have to declare all that.
How did this guy make money off of because the findings were so huge that he ended up making money off
Well,
of it?
again, this is all in the reports, but from what we gather, a lot of this, the research helped to file the lawsuits that have subsequently followed.
Whoa.
Right. So most of the lawsuits are based on this study.
Oh my gosh, so what happens now? These people receive probably millions of dollars.
Well,
due to his study.
Yeah. So, for a journal to actually withdraw an article, it's a big deal.
It's a huge deal.
Right.
So but doctor, why are we just finding this out now?
Well,
Well, it was a year ago when they withdrew the article.
Yes, it was a year ago when they withdrew the
still,
I
article.
wonder why they started investigating him in the first place.
Well, most pediatricians didn't believe this.
Oh.
Yes. So it was not all, but a lot of it was media spawned. And a lot of parents who had autism don't know why their children have autism. And what I was talking about earlier was, as scientists, we are very critical for error. That's what we're looking for.
Mistakes. Yeah.
Right. So a study was done, but certain things weren't considered. So we're like, why didn't you look at that?
Right.
But we don't think about fraud. That's doesn't even cross our minds that somebody would actually make things up.
Right, because you're out to help people.
Yes,
and
absolutely.
It's so disheartening.
And it's
Will he
unfortunate.
go to jail?
No, there is no legal implication to this.
Kidding.
No, this is not he didn't do it under oath. This is his publication. But it's sad that this one paper has really been so impactful in everything. So, yes.
Sure, I mean, it doesn't inspire confidence among parents at this point.
Right, exactly. But I don't think that this should make us believe less in research. This is one person, one article. All of us, our goal is to help people, to do research, to further our knowledge of things. And most papers are reliable.
I think, at this point with autism and the debate, you can split them up regardless if this is real or not. Just go the safety route anyway. Why not? You still have to have them vaccinated by a certain time they hit school. So just, do it.
Listen to the CDC. Yes. Listen to your doctor. Everybody is saying get your shots. Now, here's what's interesting. There's a concept called herd immunity. That means to see what percentage of people are immunized, and that gives an immunity to the whole population. So we need like a 90% immunity for MMR to prevent outbreaks. And we're there, but if this really got less, then that's a big problem.
So autism is still a mystery. There was a recent study that said if you live near a freeway, maybe environmental...
We don't know. Viruses, environmental toxins, it could be a whole bunch of things. We have no idea.
The number now, it used to be 1 in 150, now it's 1 in...
It's gone up. We don't. I don't have the exact figures, but yeah, it's certainly.
And for boys mostly. But.
Yeah, and it's confusing. We don't know. What do you do for your child?
Well, and that's why I think parents are so unsettled by it all.
Yes, and also a lot of celebrities have got into the picture and promoted different aspects of this, and if you look at the blogs and if you look at people, they are still very supportive of this guy, even though we have all this proof.
So people still believe him or want to believe him?
Yeah, everybody wants a reason for why something happens. And when we don't have it, we look for reasons.
But some things are just inexplicable.
Yes, but I mean, how hard is it to know that if a journal has taken this back, if his license has been suspended, the committee that they brought together in Britain basically said this is all fraudulent. There's all these articles by this journalist.
So he wasn't alone.
Well, there were 12 people on this article. 10 of them withdrew their support last year and said, we don't support this anymore. And 2 of them were...
Now, were these people were they taken in as well, or were they part of it, or were they taken in?
In a research study, everybody has different roles, right? So not everybody is involved in the big picture. So if one person fudges the numbers, it's not necessary everybody else knows about it.
And with some of these children, he said they had symptoms days after getting shots, when sometimes it was months after, and sometimes it was before they had the shots.
Yes. So, I think a lot of us want to see some result from a study. It's hard to have a study that doesn't really tell you anything. And so sometimes in the zeal to do things, you become biased, and that's why we have these randomized and blinded studies and things like that, to not have that bias.
His study was not at all random.
His study was
those kids.
fraudulent.
But the bottom line is, what's great about this, that when they were doing MMRs and they had those binding things in them like mercury can't be good in your body. Now they're not. They're gone. So that's a good thing. And spacing out your shots. Why not? Why put your child through all that at once when you can space it out? Just think rationally. Talk to your doctor. Make your own decisions. You don't have to...
Exactly. Do your research, but listen to your doctor. I mean, your doctor is there to help you. Your doctor is there to counsel you. And this study and all this news is good to inform people.
Absolutely.
But in the end, listen to your healthcare provider.
All right, let's talk about this subject you actually did come on to talk about. And
you didn't come on to talk about this?
This cancer blood test, which is pretty phenomenal in and of itself. You're talking about a test where you can detect one cell that is cancerous out of billions.
Yes, isn't that amazing? Now we do all these CAT scans and all these, invasive studies to find out if there's a recurrence. And you don't know if there's a recurrence for months, maybe weeks, maybe years afterwards, right? You keep doing this test till they reach a certain size.
So the new test can find one cell?
Yeah. So at Mass General Hospital, which is where I train, they've developed this film which can trap cells of a certain type. Now, we already have the technology where we can know the number of cells and see the progress or, how we're treating people. But what we don't have is the ability to look at the genetic makeup of these cells to know what kind of tumor and what it would respond to.
That's fascinating.
And so that's what's new, and it's really exciting.
It's not available in too many places yet.
Yes, there's 4 hospitals that are doing these studies. 2 of them are in Boston, 2 others, one in New York and I think one MD Anderson. So they're available on a research basis. Well, what they're trying to do, and the big news article was that Johnson & Johnson is partnering up with Mass General Hospital to make it cheaper. Right now, each film is $500. It's not affordable. But they want to make it a test that you can have in your office. So that, when
Wonderful.
Isn't that great?
So that it would be available to doctors like yourself.
Yeah. And hopefully someday, it'd just be a blood test. We don't have to do MRIs and CAT scans. Right, exactly.
That
Thank
is
you, doctor.
absolutely amazing. Stunning, actually.
Good stuff
Doctor,
today.
thank you so much. Really appreciate you
Thank
dropping
you for
by.
having me.